Physiotherapy assessments are often used to provide a greater insight into the functional capacity of an injured worker, and today I'm joined by Physiotherapist Nathan Rickard to discuss when and how to use a physiotherapy IME. Nathan, let's start with a fundamental question. What exactly does a physio do, and how does this compare with a specialist like an orthopaedic surgeon or a musculoskeletal physician?
Yeah, sure. Well, surgeons, might sound obvious, but surgeons perform surgery to correct damage caused by an injury. If surgery won't help or isn't needed, the patient is seen by a physio who helps the patient manage the injury without surgery so it can heal. Now, whether the patient has surgery or not, once enough healing has taken place from either the surgery or the injury itself, the patient sees the physio to help restore range of motion and strength and get them back to, what they need to be doing and hopefully full function, and if not full function, maximal function. Part of this process is really determining what that person's full function was. So the physio assesses the patient's work life, home life, even social and exercise and sport life to determine what level of range of motion and strength and function that person actually needs to get back to recover. And it's important to look at actually what they were doing previously in all those facets, because helping an older person get back to bridge, which might be their most taxing pastime, as opposed to getting a footballer back to tackling and kicking goals, is obviously very different. So that needs to be assessed objectively and then achieved.
So it's very much the hands-on practical aspects of managing the injury back to good health and functionality, depending on what the individual is required to do in their day-to-day activities.
Yeah, definitely.
So Nathan, what kinds of injuries are you often asked to assess? And what are you asked to comment on regularly?
Okay, yeah, for sure. Look, common injuries really are necks, backs, shoulders, knees, and pretty much everything in between. The one thing that I don't assess are hand injuries, because that's more of a subspecialty in physio or occupational therapy. Common questions that I get asked or things I'm asked to assess and then comment on is, a typical one is, given the client is now 12 months post-injury, can they return to full duties? And if not, what can they return to? To use a few recent examples, I had a prison riot squad worker who had to physically, restrain violent prisoners on average twice a week, with no warm-up, no warning even. And with this person, despite a really strong desire to return to work and attempting to complete a full strength and conditioning program that would get him up to that level, he simply couldn't get there. He kept on re-injuring, doing basic household tasks. So he was unable to return to that prior role, because if you can't stack a dishwasher, you can't restrain a violent man. And so by the end of it, my assessment at the end of a committed rehab program was that he was limited to lifting no more than 10 kilos from lower than knee height in what would otherwise be a sedentary job, no longer tackling prisoners. Another example is, I had a photographer who had been off work for a couple of years now, and he had to get back to work and be able to hold a 7 kilo camera, with only a few, 4 rests per minute, and also carry, camera equipment around to the tune of 15 kilos. Now, my assessment of him showed that he could lift those things quite comfortably. The treating physio was reporting he had no pain with everyday activities of living. So despite the fact he said, look, I can't go back to work as a photographer, he clearly and objectively he was able to. Another thing that I'm quite often asked to comment on is, given the worker's condition has now stabilised, and they have resigned for the job from which they were doing, what kind of job can they now return to? Using an example again, I recently had a supermarket shelf stacker who fell off the step she was on and damaged the meniscus in her knee. She was unable to go back to work because she was unable to bend her knee enough and climb stairs and safely lift. And so my assessment basically revealed that she wasn't able to do a job that involved stairs or carrying things upstairs. She really was more suited to a sedentary desk job that didn't involve lifting or stairs, or a retail job where she could stand all day, but she just wouldn't be able to then go up and down stairs to stock shelves in that kind of job. Another common question I get asked is, what are there any, and what's the extent of any non-economic impacts that the injury has caused? And this can be quite big. I mean, I recently, a couple of months ago, had a carpenter who hurt his shoulder at work, and it was unstable enough to make overhead carpentry basically impossible for him. But despite that, he was a lot more upset about the fact that he couldn't play tennis or surf, which were the two really big important things in his life outside of work. And the non-economic impacts were really large on him, because not only could he partake in two activities that he loved and remain physically fit, he put on weight, he became depressed because a lot of his social contacts came through those two sports. And he really struggled. So the non-economic impacts for this particular man were huge.
So it's an important consideration, isn't it? It's not just about the workplace, it's what impact has the injury had on every aspect of life, and a physiotherapist is well placed to be able to comment on every aspect the injury is affecting.
Yeah, given how we rehab clients and we see them very routinely at times, it gives us a really special insight onto the nature and extent of these impacts that surgeons, just through their interactions, don't actually get.
Very much so. And I often think that an orthopedic surgeon tells you what the extent of the injury is, and the physiotherapist talks about how that's going to impact every aspect of the individual's functioning in a day-to-day capacity. So what kinds of information can a physioime provide to a plaintiff lawyer who's now determining the extent of the injury or the capacity of the injured person in the future workplace environment?
Yeah, I mean, in short, it improves the strength of the claim, because a physio-IME adds crucial detail when determining the extent of the injury and how it affects the claimant's ability to work and live, kind of like what we were just talking about. And because we objectively define what the injured person used to do, and of these things, what they can no longer do, we're defining what loss they have suffered due to their injury in real life terms. For example, if a plaintiff has completed an appropriate treatment program, yet still displays measurable weakness and hence loss of function, my testing and reports will bolster their claims, because it can be proven that they have a permanent functional weakness and an impairment that actually won't improve further. An example is a mid-40s gardener I assessed recently. She had a degenerative lumbar spine and she kept aggravating her pain at work. She completed an appropriate rehab program, which included, strength and conditioning. However, my assessment detailed that her strength was still, that she displayed using objective testing, was still down compared to the requirements of her job. And actually there was a 27% shortfall in her strength compared to the strength she needed on a day-to-day basis. And because of this, it was clear why she was re-injuring, and she just couldn't continue doing that job.
So that's really important for a plaintiff lawyer who's putting forward a case that the person's ability to return to work it has been massively impaired, the strength aspect of it. You've touched on a number of really important points through the last example, and I want to pick up on one in particular, and that's regarding how the injury affects the claimant's ability to work and to live. And when it comes to understanding the impact of the injury on someone's pain and disability, there's been a real move away from a focus on pathoanatomy caused by an injury, so essentially the physical damage to the anatomical structure, towards an understanding of the individual's functional movement and strength. So move away from the actual visual impacts of the injury to looking more at strength and functionality. Why is this a more important measure, and how does a good physio go about defining these characteristics?
Yeah, sure. Planar dysfunction from an injury, which shows on the scan, only lasts while the injury heals. This takes 6 weeks to 3 months, depending on the tissue. Planar dysfunction that lasts after this time frame, i.e. 3 months plus, is due to a lack of strength or psychosocial factors. This is because the body part that was injured isn't now strong enough to handle what loads are being placed on it, or the person's fears about the injured body part, which can lead to ongoing warning signals and hence pain. And there've been countless research papers of recent times in recent years that show this, which is why medical management models are changing from a focus on pathoanatomy to a focus on strength, function, and these psychosocial factors. This is not to say that a bad injury to a body part can't forever decrease, function and cause pain, because of course that does happen. And sometimes, the original injury can be improved by surgery, and sometimes it can't. But as I was saying before, the degree of damage showing on the scan isn't the whole story. It's the resulting weakness that does. So a good physiotherapist defines these characteristics, i.e. lack of strength and functional capacity. And they do this objectively with strength measuring technology. And real world weights and pulleys in a gym setting. What can you push, pull, carry, hold, lift? And so we compare these results with data gained from measuring the strength and functional capacity of uninjured, healthy individuals of the same demographic.
So it's quite clear that physios are very well placed to define functional limitations experienced by an injury, but in this personal injury sector, there's a very big tendency to seek the opinion of a specialist, like an orthopaedic surgeon or a musculoskeletal physician. How can a physiotherapy IME add valuable information for a plaintiff lawyer in managing the case, more so or in addition to what an orthopaedic surgeon can do?
Yeah, sure. Well, a physio IME doesn't just look at the claimant's body and original injury, it looks at the tasks and functions that have been impacted in the claimant's life. It also objectively measures the claimant's strength. This way, a claimant's lack of strength, or put another way, a lack of capacity that has resulted from an injury can be objectively defined, even as a percentage. Because when it comes to defining how an injury affects a person's ability to work, not only is it important to objectively define a person's functional capacity, it's crucial to define what functional capacity their job or alternative job requires. To put in really simple terms, a person's maximal lift strength of 10 kilos isn't really important if they don't have to lift any weight at work. However, if they're required to lift 25 kilos 4 times an hour, well, then there's an obvious inability to return to their former job. So it's not just about what a scan shows. It's not just about the original injury. You need that objective measure of claimant capacity versus capacity required for a job. Because without this, you can't actually define the real impact of the original injury.
Yeah, and you've touched on another really important point in this very litigious environment that we're in the personal injury sector, and that's the aspect of objectivity. Obviously, any opinion that's put forward by a physiotherapist, an orthopaedic surgeon, anybody in this space needs to be able to stand up to scrutiny, needs to be able to be questioned and to be based on evidence-based medicine. So what kinds of objective testing do physiotherapists routinely engage in to ensure that their opinion is validated?
Yeah, for sure. When it comes to objectively measuring a patient, their joint range of motion, or how they can move their body through space, and also their functional strength, which is crucial. And these can be objectively measured now. Range of motion has been objectively measured for quite a while, but strength measuring is technology that used to be the AIS, and it was used in high performance sports, and like all tech, it becomes more affordable and also comes down now more into, the realm of what a physio clinic should really have. There's one system I like to use called an AXIT system, and that has push-pull dynamometry, or handles you can push on or pull on, and it measures the maximum strength you can do with those. And it also has force plates, so it can, using force plates, see what the maximal lifting strength, to use one very applicable example, how much lifting strength someone has. And it can actually measure it within 10 grams. And that's great because you can actually measure, if it's a shoulder injury, you can measure the strength of their injured shoulder versus their non-injured shoulder and give a percentage decrease the injury has caused. I think I referred to it a little bit earlier, but you can also then, for the majority of the most common tests, compare that individual's strength with a non-injured population of a similar demographic, because the software has a database of that data from multiple research papers. And so the injured person can be tested against an uninjured population, which is really, really important. And this all gets presented in a really nice, professional looking PDF report. It's, new tech is fantastic. And like I said, when it comes to range of motion testing, we've been able to do this very accurately for quite a while. But something's probably really worth pointing out, and it's often a differentiating factor with a physio IME, is that we actually need to assess what range of motion is required for a job. So whether a person's knee can bend to 125 or 130 degrees fully, it is relevant, but if they need to, if they can't and they need to be able to bend to that degree of work, that needs to be known and needs to be objectively measured.
Absolutely. And it sounds like there's a handful of tests there that we should probably drill down to and take a look at it a bit more closely in another video tutorial.
Yeah, absolutely, for sure.
So Nathan, can you summarise the 3 most important take-home points that we've covered today in terms of the important use of a physiotherapy IME in managing a plaintiff claim?
Yeah, sure, absolutely. Firstly, loss suffered by a claimant usually is not the result of the original injury and the damage that they sustained as shown on the scan. It's loss of function caused by physical incapacity or a lack of strength. Secondly, it's really crucial to accurately identify the physical demands of a person's job versus the physical capacity they now have. And it's really crucial to do this objectively to properly strengthen a claim and for it to hold up in court. It's also really crucial, lastly, to accurately assess the physical demands of the plaintiff's non-economic life. The physical and health impacts that are suffered due to non-economic impacts and loss are often underestimated and really underreported.
Thank you so much, Nathan, for sharing your expertise with us today.
Thanks, Sue.